everyone, and thank you for joining me here on Blackfoot territory. And I recognize the Métis people who share a deep connection to this land. For years now, since the UCP were elected in 2019, Albertans have witnessed the results of extreme pressures on our healthcare system. This is a direct result of the chaos that has come from the UCP war on healthcare workers, specifically doctors and nurses. Only now 1 in 3 people in southern Alberta have a family doctor, 1 in 3 people in southern Alberta can't find a family doctor. So people are waiting longer for care, and they're waiting in the emergency room because there is only the emergency room. We know that there are no doctors taking new patients and no walk-in clinics, although people are working hard to solve that problem here in Lethbridge. That's been the case for some time now. Our healthcare facilities are understaffed, under-resourced, and overstretched. Every day, I hear in the community of another crisis, whether it's the shortage of OBGYNs, whether it's the shortage of psychiatrists for the child and adolescent mental health program, whether it's the shortage of family doctors and primary care resources. We have seen across the province thousands now waiting for surgeries, and the UCP has had the opportunity to show leadership and address these issues. We have an historic surplus, but we have seen nothing but chaos, inaction, and incompetence from the UCP. And now, when people need help the most, Danielle Smith is piling on more costs and more chaos in the healthcare system with more privatized, for-profit, American-style healthcare. Now, I want to be very clear that it is our position as Alberta's NDP under a Rachel Notley government that more privatized American-style for-profit healthcare is not the answer to addressing these issues in our healthcare system in this region or across the province. The UCP plan will only create more problems for Lethbridge and for all Albertans. So now not only will people in Lethbridge be driving to Calgary after waiting months for an appointment with a specialist, because that's the situation for a lot of people right now. Now they'll have to pay out of pocket for it too. Private American-style healthcare does not work. We know this. A recent study by an American think tank found that while the US spends more on healthcare than any other industrialized country in the world, they have the shortest life expectancy at birth, the highest rate of avoidable deaths, the highest rate of newborn deaths, the highest rate of maternal mortality, and the highest rates of adults with multiple chronic conditions. We cannot let this happen here. Now, recently we have watched other provinces start down this path and expand American-style for-profit healthcare, and it results in longer wait times, more staff shortages as the for-profit system siphons already short-staffed workers out of the public system, and more families having to eventually, if Danielle Smith gets her way, going into debt for basic healthcare. Danielle Smith has said, she's been very clear in recent months, while she was campaigning for leader, that Albertans, quote, need to start getting used to the idea of paying for healthcare. I do not agree that Albertans should ever face that harsh reality of being handed a debit machine while laying in a hospital bed waiting for a surgery. I do not agree with Danielle Smith that families in Lethbridge should worry about fundraising to top up their health spending accounts so that they can have any hope of getting the healthcare that they need. No one trusts Danielle Smith and the UCP to use the pressures, that Danielle Smith and the UCP won't use the pressures from COVID as an excuse to expand American-style healthcare and mislead Albertans that it will be somehow a magical fix. It will only cause more chaos and more instability. It will pull staff out of public healthcare. Now, under a Rachel Notley government, the Alberta NDP will keep healthcare public. We will be rolling out our plans for family medicine to ensure that everyone in Lethbridge has access to a family doctor and the primary care that they need. We will be coming forward with a more specific plan for Lethbridge and southern Alberta to improve staffing across the system. We have already pledged the largest healthcare recruitment effort ever seen in this province's history. We believe that every Albertan, no matter how much you have in your bank account, deserves equal access to high-quality care covered by universal public health care insurance healthcare when you need it, not when you can afford it. What we cannot afford is 4 more years of chaos, incompetence, and cruelty under the UCP. It is time for a caring, stable, competent government, and that is what the Alberta NDP is offering to Albertans. Thank you, and I'm happy to answer any questions.
All right, thank you, Shannon. Just a reminder for those joining us on the phone to use the *9 function, and for those joining us on Zoom to use the raise hand function to get into the question queue. We will start with questions in person. Just state your name and outlet at the top.
Hi, Shannon. David Opinko from Lethbridge News Now. So you mentioned in your talk just now that the UCP has been pushing for more like the private out-of-pocket health care. What we've been hearing from the UCP in some of their announcements is that these would still be covered by the public funds, like at least as far as like those private chartered surgical facilities. Can you just explain what the difference is between those?
Well, what the UCP now have set up is a scheme whereby for-profit surgical facilities will bill the taxpayers for their services plus a layer of profit, and that those bills will go into the government to pay. But what we know, because we have a number of other places where this happens, but B, we already have experience with this in Alberta. This has already happened within the Calgary region back some 10, 15 years ago when the Health Resources Group actually had to declare bankruptcy. But what ends up happening is they charge extra fees to people who need some of these surgeries. And so essentially patients are in a situation where they are choosing between the basic level and the Cadillac version of healthcare that they can pay out of pocket for. Meanwhile, these for-profit entities are skimming a layer of profit, and they're doing it on our dime. What we could do instead is expand our surgical and specialist capacity within Alberta Health Services. You then forego those extra costs of an extra layer of profit, and you are not siphoning healthcare workers, whether it's surgeons or nurses or other frontline workers, out of the facilities where we are all seeking care right now and into a for-profit stream. So those are both the realities and the risks of what the UCP have brought in.
Yes, I know you said that more specific plans as far as like family medicine and everything are still to come, but as just a general overview, what more could the provincial government be doing to attract and retain family doctors?
Well, there's no question that ensuring that we have a competent government at the helm that respects public health care is, I think, the first step there. The second step is, of course, to ensure that we have the right compensation framework, not just for physicians, but for other primary healthcare providers. And third, we need to make sure that both we have the physical infrastructure in place, whether that is new clinics, new primary healthcare clinics, where we have the right care team model in place as well, because it's not just about family physicians. It's about that whole continuum of care for people. And we know that that model, when invested in a way that respects both public health care, the people who work in it, and the people who have to access it, we know that that can help catch people's issues earlier, reducing the need for specialist care and so on, but also ensuring that we have better continuum of care from those primary care providers into specialist care should it be required.
Hi, Ryan Clark with Lethbridge Herald. My question is, with the economy the way it is right now, we're seeing inflation prices skyrocketing and privatization of healthcare added onto that. What are some of the consequences that we could see in the future if people have to start juggling a budget and have to put healthcare in that when they're already having trouble affording things as is?
Well, you know, Danielle Smith has said that Albertans should be prepared to fundraise for their health spending accounts. And she has also said, as recently as 8 months ago, when she was running to be UCP leader, that Albertans should get used to the idea of paying for healthcare. Albertans are already very, very uncomfortable and not at all used to paying for higher utility bills, higher insurance bill, higher tuition, higher property taxes, all of those things that have gone up under the UCP and that are really having an effect on people's pocketbooks and their wallets. They do not need another layer of costs. But also, what Albertans don't need is fewer healthcare professionals, whether it's physicians, nurses, or others, whether it's psychiatrists, OBGYNs, specialists, or the other frontline healthcare workers that go with a lot of that specialist care. And that's exactly what we're seeing right now. We don't need less, and we don't need of those folks, and we don't need more costs. We've already dug ourselves into a significant hole with respect to healthcare and with respect to costs going up for ordinary Albertans. It is time to stop digging, and the only way to do that is to replace this government of chaotic instability with a government that is competent, that is caring, and that has respect for public health care.
Hi, Jacqueline Cousy, Global News. So last week, the UCP released a statement that they're going to be implementing 2 health training centers, one being out of the U of L. In an NDP government, if NDP are elected, what firm promises are you making that will get doctors here quicker than UCP?
Yeah, for sure. I think we're going to have to take a closer look at that training center, whether it comes with funding, for example, whether it is just an empty promise. We've seen plenty of those from the UCP. But if it is a real promise, it's a good start. They should have done it 3 years ago. And instead of going to war with doctors, there should have been a plan to ensure that we are recruiting and retaining healthcare professionals. So too with nurses and other allied health professionals. There is no question that there is a significant hole dug, not just in healthcare and the number of professionals that we have within the public healthcare system, but also in post-secondary education, where we have seen $700 million in cuts across the system. We have seen a number of programs be reduced across Southern Alberta. We've seen programs in Medicine Hat, for example, reduced around healthcare. All of those do not help, and in fact make the problem worse. And so all of those things have to work in tandem, and it starts with some stability in budgets, some competence in government, and electing a group of people that is worried about Albertans, not about themselves, because we have seen nothing but several years of UCP internal drama and soap operas. That doesn't help any of us who are looking for health care.
Just a follow-up question. So what are the specific promises that the NDP would be making?
Sure, absolutely. I think we should stay tuned on that. Rachel Notley and I will have more to say around our a far more detailed plan around primary health care and recruiting doctors, nurses, and others into the Southern Alberta region as we go forward closer to the election. There is no question that there is a huge hole that Southern Alberta has to dig ourselves out of. It will not happen in a year, or it may take even longer to actually undo so much of the chaos and instability that has happened. But we can start with having clear plans, not paper promises.
And we'll do one last pass for questions. With no further questions, we'll wrap today. Thanks, folks.